A lot of people are still worried about nerve damage when it comes to deep plane facelift surgery. And it's interesting that these kind of old fears still prevail. Yes, 50 years ago when Sam Hammer introduced deep plane facelift surgery, a lot of surgeons said this is far too aggressive, this is dangerous, you're sitting on top of the facial nerve and you're going into tiger land was one of the very, very famous quotes back then, that it's just an area where you will end up with some issues. And I think ever since then, our anatomical understanding has improved tremendously. And yes, when you do deep plane, obviously you see the facial nerve in many areas, but let's not forget that the facial nerve is still covered with some connective tissue. So you want to stay above this connective tissue. And I believe if you take your time, you do your research, you study your anatomy, and you train your eyes and hands, nerve damage, if so, it's not going to be you cutting through the nerve. It might well be that the nerve is a little bit upset because you've pulled on it or you pushed against it, but there are so many collaterals. And what I mean with that is we have 5 branches of the facial nerve, but these branches, these main branches, are interconnected. So very, very often one of these interconnections would jump in and take over the job. So very often it's just a few weeks if one of these nerves is weakened. Very often it can be the nerve going to the lower corner of your mouth, and then you have a little bit of a lazy corner, and after 3 to 6 weeks this is going to be improved, or it can be on the forehead. The other nerves are not that easy to upset. But as I said, very often the face takes care of it, and it's just a matter of, as Mike Nayak says, put a little bit of vitamin T into it, give it a little bit of time, and the healing takes over and the nerve gains the full function again.